So they're here, the long-awaited COVID vaccines, and they're up to 95% effective. The hard work's done. All we need to do now is inject them, right? Well, that's a lot easier said than done.
We have a vaccine, so it's very good news.
How can we roll that out? How effective is that going to be?
Help is on its way. We can now see the way out.
So who gets it first? It'll be the most vulnerable in our society. Healthcare workers, care workers and people over the age of 80. Then it'll be people in their 70s, then 60s, then 50s and finally the rest of the population.
We are suggesting that vaccines are offered in order to protect people who are most at risk of dying from COVID-19, as well as to protect health and social care services, because by doing so, we also protect lives.
The only people who won't get the vaccine are pregnant women and most children. That's because there's not enough data for those with a baby on the way, and most children are at mild risk from the disease. You could be waiting a while for your vaccine though. The NHS hopes to immunise 1 million people a week, but it could be the middle of 2021 at the earliest for most of us. So where will we get the jab?
Well, there'll be a combination of 3 modes of delivery.
Hospitals, mass vaccination centres and GPs or pharmacists. This stadium in Derby is one example of a mass distribution centre. It's been taken over by the government for distribution. So to get the vaccine, you might have to come to stadiums or sports halls like this in cities around the country. Or maybe to one of the 50 hospital hubs set up to store vaccines around the country. But some of the more easily distributed vaccines will also be offered at local GP surgeries. And all of the vaccines will need 2 doses a few weeks apart. While it's true the hardest work is done, distributing the vaccines is going to be one big logistical challenge.
You mentioned the -70 conditions that it needs to be stored in, so this is a challenging rollout.
The Pfizer vaccine will be the hardest to distribute because it has to be stored at -70 degrees Celsius. For comparison, most freezers sit at around -18 to -30 degrees. On top of that, the vaccine must be used within 5 days of being moved to a fridge. That's not an optional best before date, it's use it or lose it.
And while it's effective at protecting against the virus, it's really expensive.
The other 2 vaccines are much more practical.
The AstraZeneca vaccine, that doesn't have these cold storage requirements and so is operationally easier to roll out.
Moderna's can be stored at normal freezer temperatures of -20 degrees for up to 6 months. And best of all, the Oxford vaccine can be stored in the fridge. The Oxford vaccine is also the cheapest of the 3. In fact, it costs the same as a cup of coffee.
The final hurdle for a vaccine is psychological. How do you get people to have it?
A study in September 2020 found that only half of Britons say they would definitely take the jab. Almost a fifth say they would refuse it in all circumstances. So how do you convince people to take it?
Vaccine deniers and the people who are generally suspicious of vaccines will always be there. But I think the nature of the pandemic, first in a lifetime, remember, is such that most people will recognize that this is the way you're likely to be able to control it.
All 3 vaccines are more effective than the flu jab, but people are more trusting of the flu vaccine, older people especially.
So, despite clinical trials showing the vaccines are safe, some kind of public information campaign will be needed to encourage people to take them.
Or it could be pressure from the private sector, with some companies refusing the general public without proof of the vaccine.
We are looking at changing our terms and conditions to say for international travellers that we will ask people to have a vaccination before they can get on the aircraft.
The fastest vaccine ever made until now took 4 years, so for there to be safe and effective COVID vaccines within 12 months is nothing short of extraordinary. But with 50 million people in the queue in the UK alone, it could be a while before you get the jab. That could get us all back to normal.